Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
It is August, and that means it's time for parents and their children to start thinking about heading back to school. You ready for that?
I'm daydreaming about it right now.
Well, depending on the age of your kids, sending them back to school could involve some more immunizations, sports physicals, or just a good time to check in on your child's overall health and well-being.
Here to discuss getting ready to head back to school is Mayo Clinic family medicine physician, Dr. Elizabeth Cozine. Welcome back to the program, Dr. Cozine. It's great to see you.
It's always great to be here. Thanks again for inviting me.
So you still like being a family doctor?
It's still going great.
And do you sort of specialize in treating kids?
So the advantage of family medicine is we treat everybody. So we see kids, babies, adults, old people, many of whom are going back to school. So, we're trying to take care of the whole family, which I think is really advantageous when we're talking about something like overall kid health.
So for the older child, what sort of immunizations do they need, let's say when they're in grade school or middle school?
So when you get out of babydom, it sometimes is a little bit tempting to not have your kid to be seen because there's not that structure of every few months where you're being seen during infancy. Right. In the older kid, there's standard immunizations before kindergarten, and then the next set of routine immunizations, other than annual flu shots, are at about age 11. The HPV immunization can be given as early as age 9, which is when I recommend doing that shot. HPV is human papillomavirus, which is the virus that causes cervical cancer and genital warts. And we know more and more head and neck cancers are also related to HPV.
Sexually transmitted.
Correct.
Which is the reason you want to give it so young.
Precisely. So
that's a confusion. I was just going to say, because people then say, well, my 9-year-old's not
right.
sexually active.
People get pretty uncomfortable when you start talking about sex with 9-year-olds. But I tell people this is not about sexual activity. This is actually a cancer immunization. Right. And you could think about it similarly to hepatitis B, which is also a cancer immunization. Hepatitis B causes hepatocellular carcinoma. HPV causes other cancers. It's very effective. It works. And so we know that if you catch kids before they've had any sort of sexual activity, plus, they also have a better immune response the younger they are. So when this immunization was first released, it was a 3-shot series. And now in 2017, it was made to a 2-part series if you get it before age 15. So those kiddos that are between 9 and 15 mount a beautiful immune response. They only need 2 shots. That's a major selling point.
For life.
Correct.
Never need a booster shot
no
or
booster.
Anything. Okay.
Boys and girls.
Boys and girls.
Mm-hmm.
And it prevents cervical cancer in women, prevents genital warts, and prevents herpes virus-related cancers of the mouth and throat.
Correct. It's against the most virulent strains, the strongest strains, which are HPV 16 and 18, among others.
Let's talk about other things that school-age kids, the younger kids, need to have done. And the one I've got at the top of my list of to-do is getting eyes checked.
Yeah.
So what about eyes and ears? How often do you need to get that checked?
So it's really useful to have those checked, certainly if there's a problem. But otherwise, we do routine screenings at well child visits. That's also part of routine screening at, for example, preschool screening, depending on your school district. Annually is a pretty good idea to make sure you're at least touching base. Can my kid see? Is my kid acting out because they can't actually see the board at school?
And sometimes they don't know. They really don't know that. They don't recognize
Kids
that
get used
they
to not
can't
seeing.
see. Right.
Mm-hmm.
So what do you recommend in general? What sort of regimen, what sort of schedule should parents follow for their kids? How often should they really see you, assuming that they're healthy?
Yeah, so a lot of this comes from guidelines put out by the American Academy of Pediatrics, and there's a pretty standard well-child routine. So I'll not talk about infancy, but kind of the school-age kid, kindergarten, 7, 9, 11, 13. That matches up pretty well with the standard sports physical routine, and then certainly before college.
We were talking about immunizations around 11, and the one you talked about was HPV. Are there others that you ought to get at 11?
Tdap, which is tetanus, diphtheria, and pertussis, is given at age 11. Before that, you get the DTaP, which is a different formulation of the diphtheria, tetanus, pertussis vaccine. So you get that at 11, and then as an adult. And then the other immunization at age 11 is MCV, which is meningococcal.
Okay, and that's what the college kids need also?
Correct. And so the booster for that is given as early as age 16. It might be 15. Don't quote me on that. But
okay.
As a teenager, later.
Yeah.
And my nurses are really, really good at reminding me about that.
And so is Epic.
Yep.
The new medical
You got
record.
it.
It'll pop up.
You got it.
Yeah, it's pretty helpful.
Yeah.
So There hasn't been a meningitis outbreak for quite some time, and this is a vaccine against bacterial meningitis, isn't it? Or
Correct.
Is it? Yeah,
Correct.
not viral. You could
Right.
still get viral meningitis.
Correct.
Why on college campuses, other than the fact that people are living relatively close together?
Yeah.
And it's potentially lethal.
It's potentially lethal. So we know that meningitis tends to be in places where there are groups of people living together. So most people who've been to medical school can quote that the incidence of meningitis was, 10% of Army recruits are colonized with meningitis. And the example is that people who are clustered together are more likely to be spreading that illness. So college kids going off to the dorms, that's a high yield group of people to immunize against this illness.
What about hygiene? What do you tell parents and kids about hygiene when it comes to helping prevent colds and flu?
Usually I kind of see the parent waving across the room like, can you get him to shower? Can you tell him? So I usually say something like, I think it'd be a really great idea to take a shower every day. I just try to be really non-judgmental about it and say, in most cases, taking a shower every day is good because as you start to be an adult, you sweat like an adult, and sometimes you sweat and you smell like an adult.
Those fifth graders.
What about,
those fifth graders.
coughing and hand hygiene? Do you talk to them about that?
Oh, I don't have to talk to them about that because at school they talk about dabbing, so they cough right into the arm. But cough into the shoulder.
Do you know what that means, Dr. Shives?
dabbing?
We'll talk about it
I
afterwards.
learned from my kindergartner.
That's
so.
right.
Is that right? Where you cough into your elbow? Is that what it is?
It's a dance move.
Yeah.
Dabbing?
But yeah, cough into the elbow. So most daycares and schools are doing a beautiful job of that. But yeah, we try not to cough into the hands.
Okay, here's the question that I've got because it hurts me to watch my children. Well, not the first few days, but when you've got that backpack so loaded down, what is that figure for how heavy a backpack can be?
I think it's somewhere, I'm not exactly sure of the exact amount, but if you see your kindergartner who looks like they're tipping over, that is too heavy. So, certainly less than 10 pounds would be maximal. And it shouldn't be digging into the shoulders, and think about your kid is not a pack mule. So encourage them perhaps to do a little bit of efficiency of packing.
We're going to talk about teenagers and college kids a little bit after the break, but I just want to know for the little bitties, mine are older, yours are younger. Do any of yours have are they scared to go to school? Is there some trepidation there? And what can parents do?
It's really interesting. My kids are going into second grade and going into kindergarten. And now that I've been through this kindergarten transition coming up for the second time, they're nervous about it. They're not quite sure what to expect. My little guy who's going into kindergarten says, I'm ready to be in school. But he's also kind of scared. And so I talk to parents about that too. Anytime there's a life transition, that's a stressful event. That goes for a kid going from preschool to kindergarten. Maybe it's their first school experience, for a kid going to middle school, which is another life transition, and heading off to college. I think just talking to kids about it's normal to feel concerned about what something is new and unexpected. And any kid and anybody who's had a baby knows that human beings like routine. And so when your routine is a little bit upended, that's stressful. And so acknowledging that sometimes the way a 5-year-old manages stress is by acting kind of badly. A teenager might do the same thing. And say, are they acting out because it's sport for them, or is there something else going on?
All right, we're talking about kids and going back to school with family physician Dr. Elizabeth Cozine. Time for a short break, but when we come back, we got more to talk about. This time,
teenagers.
Teens. You got a couple, huh?
Yeah, both physical and mental health checkups for teens. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae, and I just taught Dr. Shives how to dab. No, that was terrible. We're back
that
talking.
Wasn't good? I didn't do it right?
Just practice.
Show me again.
Dr. Cozine, we could have your kids. My kids would not show up for Dr. Shives to teach him how to dab.
They do it next time.
Yeah. All right.
But that's really, then that helps when you should cough. You should dab when you cough. Isn't that what you
That's
said?
what I said. That's what I said.
Show
Try
us
it out.
again.
Try it out.
Show
We'll
me
just go
again. You go,
There.
perfect.
Believe you.
All right.
So dignified.
There'll probably be fewer colds this winter
Oh,
because of the
I think so.
dabbing.
Let's do it.
All right, Dr. Cozine, aren't you glad you joined us today?
I'm thrilled.
Okay,
I'm thrilled.
great.
Thanks again for having me.
All right, let's talk about teenagers.
Let's talk about your teenagers.
I really don't want to.
let's talk in general.
Well, one of the things that's funny is that we were talking about well child visits. And so it's 9 years old and 11 years old. When you go and set up that 11-year-old one, they do not want you to call it a well child visit. They're like, Mom, do we really have to? So I started saying wild child visit, and that makes them happy.
That's great.
So do you see teenagers just giving you the I'm not going to say a word and sit here thing? Or
They definitely do that. And my policy is that once a kid is 12 or 13, I absolutely kick the parents out of the room. Sometimes they don't want to say anything to me alone either, but that gives them an opportunity to talk to something that they might not be super excited to discuss with their moms and dads. And I always talk about drugs, alcohol, sex, all the stuff that makes adults really uncomfortable.
And do they?
Yeah, they do.
Mm-hmm.
They do. Yeah,
That's
they're really. It's pretty surprising. I think I'm always tempted to sort of underestimate what somebody's going to tell me, but pretty much they just start talking.
One of the things.
Wait, no, let me just ask. So I got this important question. So when you kick the parents out of the room, what's the most common question that a teenager asks? Gender specific.
There's not a most common. Usually, I'm kind of trying to goad them along.
Yeah. Okay.
And
they're just more
I
likely
say
to
things
answer.
like condoms, and they turn purple. But it's at least they're hearing about the really importance of taking care of yourself and respecting yourself.
One of the things that also happens when you send kids to wild child visits is a depression screener.
Right.
And what age does Mayo Clinic start doing that with their patients?
We start routinely at the 13-year well visit, and that's with what's a standardized tool called the PHQ-9M, which is a patient health questionnaire, which is a standardized depression screen. The M stands for modified, and it's been validated for use in teenagers. It's a really great tool to help us just get an idea about whether or not a teen is struggling with their mood.
And do kids respond to that? I mean, if they have a score on that PHQ-9 that makes you concerned, do they respond?
They do respond really well to it, because usually when they're coming in and they're answering those questions, it's an opportunity for them to really express how much they might be suffering. And it's not always something that we pick up just on a well visit, but it's a great opportunity for us to talk about it. And I use that question as the scale as kind of an opportunity to say, hey, I noticed that you answered this question where you feel like you've kind of been a failure to yourself. What do you mean by that? And it gives me kind of an entree to the conversation.
When you see a teenager for a checkup or routine visit, are there any tests that you get routinely, any blood tests or chest x-ray or anything like that?
So that depends a little bit, interestingly, on the type of insurance. For our patients who are on state insurance, for example, Medicaid rather, there are specific tests that need to be done. For example, hemoglobin in a menstruating teenager that are required to be done for insurance reimbursement purposes. In general, there's not, I often will get a lipid panel once in a teenager to kind of see where they end up.
And what's on the lipid panel?
Cholesterol screening,
Okay.
Thank you, yeah. And chlamydia screening in teens.
Men and women?
It's
And
recommended in women only, but offer it to boys as well, to girls.
It's a sexually transmitted disease that's asymptomatic.
Correct.
Okay, so
men are usually symptomatic, women aren't. It can be a threat to future fertility, which is why we tend to go after that as a screening opportunity.
And how do you do the screening?
It actually can be done via urine, which is how I tend to do the chlamydia screening in a teenager, because they don't always need a genitalia exam or a pelvic exam. And it can also be done with an endocervical swab, which is a swab inside the cervix. But kind of getting, back when I was a teenager, it was recommended that you start having pap smears within 1 year of having sex. Those guidelines have changed really quite a bit. And so now we recommend first pap smear at age 21. So that's also an opportunity for me to say to a teenager, hey, let's talk about sexual health, let's talk about birth control, but I don't necessarily need to do a full pelvic exam, and you're not going to have a pap smear as sort of a carrot to get them to do the birth control.
We don't have to do that yet.
Right.
Okay, but if you've had the HPV vaccine, the chances that you're going to get cervical cancer are
those rates are
slim.
plummeting.
Yeah.
It is a beautiful, beautiful thing to see that the rates of cervical dysplasia are much, much lower.
So do you still need if you've had the HPV vaccine,
Correct.
still
So
need the
yeah, at
pap
this
smear?
point, I think it'll be really interesting over the next 10 to 20 years to see what happens with the rates of HPV immunization and how that changes the cervical cancer screening guidelines. But for now, age 21 every 3 years in your 20s, and then those guidelines change once you're 30. But
Yeah, tell us about sports physical.
Well,
Tracy.
I've got on my list here sports physicals, but I also just want to know for kids that are active. I mean, because when the little ones are playing soccer, that's one thing. But when they get to be teenagers, you do have to do a sports physical before you can play sports in most states. But
Right.
even being healthy enough to do sports is something of concern as well.
Right, and so the sports physical, again, is a great chance for us to talk about family history, talk about questions that they maybe haven't ever thought about. So cardiovascular risk factors, have they ever fainted? What's the family history of asthma? And a lot of states, I can speak mainly just to Minnesota, have a standardized form that they ask the kids to fill out beforehand. And then that also helps with the conversation about what do we need to potentially be worried about here. And then, the vast majority of kids don't need any sort of intervention based on the sports physical. But it's a great chance to check in with those teenagers who otherwise might not come in.
Well, no question about it. The well child visits are important, and you've suggested that biannually, every other year, you get a well child visit.
Wild child.
A wild child.
Child visit, sorry.
Yeah.
And the immunizations,
Right.
important, and particularly the human papillomavirus.
Right. And a big plug for influenza annually. I know in our school district here, they're doing it at school, which is super convenient.
I think we should also talk about, just briefly, although the teenager stuff kind of breaches over into college kids, are there other things besides the immunizations that college kids, parents should be thinking about before they send their kids off to college?
One of my main spiels with the college kids is talking about binge drinking and safe behaviors and making sure that you are in safe situations. I think that a conversation I'm not that great at yet is discussing social media use in teenagers, and I'm really trying to refine that. I'm not very old, and a lot of this is still pretty foreign to me, and thinking about what you might snap or what you might WhatsApp, or I don't even know what all the different
You know what you
things
might
are.
snap? A dab.
Yes,
You might
could snap
snap a dab, Tom.
Right, exactly.
I
And
gotta be careful.
And so one part of the thing that I talk about is, it's probably not a good idea to send naked pictures of yourself to anybody. And people kind of roll their eyes at me, but say, look, I'm a mom. I really want you to be safe and taking care of yourself and being in positive relationships.
It's a tricky business because that brain hasn't finished developing, but there's a lot of binge drinking or any of those things
exactly.
that can make a big difference in the rest of your life.
But also I point out to students who are headed off to college or elsewhere what their resources might be. A lot of college campuses have free walks home, free rides home, these really important safety tools to help facilitate those good decisions.
Yeah, well, when you get to be my age, you have no idea what's going on. Can you imagine when I grew up, sending a naked picture to your girlfriend? I mean, really?
It's true, Tom.
I don't think they should be doing it now.
No,
It's true.
Yeah.
Tell me that doesn't happen.
We're going to just, look it, we're out of time.
Thank goodness. Back to School for Kids with family medicine physician Dr. Elizabeth Cozine. Thanks so much for being with us.
Thanks again.